Today we will sum chest radiographs. Enter slide note.
This is radiographs of a 60-year-old man with a cough and fever. See this case deeply and stop video. Make your diagnosis. Chest radiographs shows bilateral airspace infiltrates. There is also dilatation of the upper esophagus in the PA view, white arrows, with an air fluid level, red arrow. The lateral view shows a retrocardiac mass, B, white arrow, suggestive of a dilated lower esophagus. The trachea is displaced forward, B, red arrow. Coronal CT shows a dilated esophagus, C, arrow, and the airspace disease. Axial CT images confirm dilatation of the esophagus, which is full of residue, D and E, arrows. Final diagnosis, esophageal atresia with secondary aspiration pneumonia. In this presentation I intend to discuss the appearance and differential diagnosis of air fluid levels in the mediastinum, chest wall, and subdiaphragmatic area. 72-year-old woman with a large hiatal hernia with an air fluid level in the lower middle mediastinum, A and B, arrows. By far, hiatal hernia is the most frequent cause of air fluid level in the middle lower mediastinum. It has a typical appearance as in this case and is very common in the elderly. Rounded retrocardiac mass, arrow, located in the lower middle mediastinum in the lateral view, B, arrow. Esophagogram demonstrates an airless hiatal hernia, C, arrow. PA radiograph shows bulging of the paraesophageal line, white arrow, with a mediastinal air fluid level, red arrow. Esophagogram shows distal esophageal stenosis, B, arrow, with dilatation and air fluid level. Diagnosis, atresia. PA radiograph shows a dilated lower esophagus, white arrows. In the lateral view, an air fluid level is seen in mid-esophagus, B, white arrow, and there is thickening of the retrosternal stripe, B, red arrow. CT confirms the dilated esophagus, containing air and fluid, C, arrow. Diagnosis, esophageal atresia. 62-year-old man with trouble swallowing. PA radiograph shows an upper mediastinal air fluid level, arrow. Lateral view shows an opacity occupying Rader's triangle, B, white arrow, with an air fluid level, B, red arrow. Esophagogram showed a Zenker diverticulum, confirmed at surgery. Patient after resection of the lower esophagus and pulling up of the stomach, C, arrow, giving the air fluid levels apparent on chest radiographs, A and B, arrows. 47-year-old man with pneumopericardium and an air fluid level after heart surgery visible in the PA view, arrow. 84-year-old man with metastatic lung disease and a large hiatal hernia simulating pneumopericardium in the supine radiograph, arrows. Enhanced coronal CT confirms the massive hernia, B, arrows. 47-year-old woman with carcinoma of the breast and a liver abscess seen as an air fluid level in the ruck of the abdomen, arrow. Enhanced axial CT confirms the intrahepatic location of the abscess, B, arrows. 1. Most common cause of air fluid level in the lower middle mediastinum is hiatal hernia. 2. Most air fluid levels in the mediastinum are due to esophageal obstruction. 3. Subdiaphragmatic air fluid levels are due to abdominal abscess or dilated bowel loops.